The cardiac exercise stress test is a crucial tool in cardiology, used to evaluate heart function under stress, diagnose heart conditions, and guide treatment decisions. One of the primary indications for a stress test is the diagnosis of coronary artery disease, or CAD. It's especially valuable for patients with symptoms like chest pain, shortness of breath, or fatigue during exertion. For those with atypical chest pain, the test helps determine whether the symptoms are related to heart disease. It can also be used for high-risk individuals who may not show symptoms but have factors like diabetes, high blood pressure, or a strong family history of heart disease. For patients with known CAD, the stress test assesses the severity of the disease, helping to evaluate the risk of future cardiac events. After a heart attack, it can gauge the extent of heart damage and the likelihood of further complications. Additionally, it's used before non-cardiac surgeries to assess the risk of cardiac complications during surgery. The stress test is also key in evaluating exercise-induced symptoms. It can help determine whether shortness of breath is due to heart issues or other causes, such as lung disease. For those experiencing irregular heartbeats or fainting during exercise, the test provides critical insights into these conditions. In cardiac rehabilitation, the stress test guides the development of safe exercise programs, ensuring patients can recover effectively. It also evaluates functional capacity, which can be crucial in determining work capacity or eligibility for disability. The test is essential for monitoring the effectiveness of treatments like medications, angioplasty, or coronary artery bypass surgery. It helps in adjusting medical therapy or deciding on more invasive procedures if necessary. In preventive care, the stress test is used to screen athletes for underlying heart conditions and individuals in high-risk occupations, like pilots or firefighters, to ensure they're not at increased risk of cardiac events. For patients with valvular heart disease, the stress test evaluates how the disease impacts exercise capacity and aids in planning for valve surgery. In summary, the cardiac exercise stress test is a versatile and essential tool for diagnosing and managing heart conditions, assessing exercise-induced symptoms, guiding treatment decisions, and evaluating overall cardiovascular risk and exercise tolerance.